Hello guys, welcome back to my channel The Physio Sapiens. This is the third video for strengthening, and in this video we are going to learn about all the different regimens for strengthening. These are the DLOMs, the Oxford, the McQueen and the DAPER, that is daily adjustable progressive resistive exercise. All this we are going to learn in this lecture, along with in which conditions, which regimen you are going to use, with the indications and contraindications of strengthening, and one important thing, that is how will you progress from grade 0 of MMT to grade 5 of MMT. So how will you progress? What are the different exercises you will give to progress the patient which has grade 0 to grade 5. So coming on to the first two regimens, these are the DLOM's regimen and the Oxford regimen. In DLOM regimen, it is progressive loading of the weight. Okay, so in the last video we have learned how to calculate 1 RM and 10 RM. So if you haven't watched it, go there and learn how to calculate the 10 RM and then come back to this video. So after you have calculated the 10 RM, you need to progress. So the first set is 50% of 10 RM for 10 reps. The second set is 75% of 10 RM for 10 reps. And the third set is 100% of 10 RM for 10 reps. So 30 reps in total is divided into 3 sets for 10 reps each. Okay, and it is done 4 times per week, and the progression of the load is done weekly. So every week you will calculate the 10 RM and increase the load accordingly. Okay, it is done in acute conditions, and the fatigue increases with the coming sets as the load increases. So after the first set, the fatigue will accumulate. In the second set, again the fatigue will accumulate. So it is more fatiguing to the patient, but the benefit is the muscle gets warmed up by the lesser weight, and as the weight progresses, the muscle gets ready to take up the load. Okay, now coming on to your Oxford's technique. Oxford's technique is regressive loading. So what does regressive loading means? So the most difficult task, it is said that eat that frog first thing in the morning. So doing the most difficult task in the first set itself. So 100% of 10 RM is done in the first set, 75% of 10 RM in the second, and 50% of 10 RM in the third set. Similarly, 30 reps 4 times per week, and it is progressed weekly. So it is done in moderately trained individual. You don't do it in acute conditions because the person does not know the exercise. So giving 100% of the load in the first set immediately is not the right thing to do. Okay, so after the person has customized with the training program how the exercise is done, you can then progress to Oxford's technique. Okay, the benefit of this technique is that the most difficult task is done in the first set itself. So the next sets are less fatiguing. Okay, so this is the benefit of Oxford. Both these techniques are equally beneficial. In this we do 50%, 75%, 100%, and here we do 100%, 75% and 50%. According to the research, both are equally beneficial, but according to the condition of the patient, you can choose either of the regimens. So the next regimen is the McQueen's technique. This is a constant loading type of regimen. In this we have 4 sets of exercises in which we give 100% of 10 RM for 10 reps each. Okay, so 40 reps 3 times per week, and we progress the 10 RM after every 1 to 2 weeks. In this type of technique, there is increase in the endurance as well as the strength of the individual. So therefore there is slow progression in the strength as the 10 RM for each set is maintained. We don't progress it from 50%, 75%, 100%. We only give 100% of the 10 RM only. So it can be used in maintenance programs. Now the fourth regimen is the DAPER technique. So DAPER stands for daily adjustable progressive resistive exercise. So as the name suggests, we daily adjust the resistance given to the person according to the previous session. Okay, so let us read it out first and then I will explain it to you. So in the first set, okay, here we take into consideration the 6 RM, not the 10 RM. Okay, in the first set we do 10 reps of 50% of 6 RM. In second set we do 6 reps of 75% of 6 RM. In the third set, we ask the person to do the maximum amount of reps for 100% of 6 RM. But now, in the fourth set, we adjust the weight according to the number of reps done in this set. So, how do we adjust the weight? According to this table. So, according to the reps done in third set, we change the load in the fourth set and also the load in the next exercise session. Okay, if the person does 0 to 2 reps in the third set, now we will decrease the resistance because it is 100% of 6 RM. So it should actually, the person should actually do 6 reps because it is his 6 RM, but he is doing less than that. Therefore, we will actually decrease the load by 5 to 10 pounds. Okay, and in the next exercise session also, we will decrease the load of the entire workout plan by 5 to 10 pounds. Okay, now if he does 3 to 4 reps, now we will decrease the load by 0 to 5 pounds. Okay, now and in the next exercise we will keep the weight same because taking into consideration that after taking the rest and because of the micro trauma caused in this session, the person's muscle will grow and then he should be able to do those 6 reps in the next exercise with the same weight. Okay, so he will perform better. Assuming that he will perform better in the next exercise session, we keep the weight same. Now, what if he does 5 to 6 reps? Then in the fourth set, you will keep the weight same and then again ask him to do the maximum amount of reps. But in the next session, we will increase the load by 5 to 10 pounds. Okay, now for example, if he does 7 to 10 reps in the third set, then we will increase the weight in the fourth set by 5 to 10 pounds and in the next session we will increase the weight by 5 to 15 pounds. Okay, and if it does 11 or more than 11 reps, then in the fourth set we will increase the weight by 10 to 15 pounds and in the next session we will increase the weight by 10 to 20 pounds. So this is a highly customizable plan. This is a highly customizable technique. Okay, you need to adjust the weights of the fourth set according to the number of reps done by the individual in the third set. So daily adjustable progressive resistance technique. This is done in highly trained individuals whose main goal is to focus maximally in increasing their strength. Okay, and you need to progress the fourth set of each day and the next exercise session according to the previous exercise session. Now talking about the uses and indication and contraindications of strengthening. So what are the uses and indications of strengthening? These are muscle weakness. So the main goal of strengthening is to increase the strength, power and endurance of the muscles. So the muscle weakness will be avoided. The next is bone mineralization. Bone mineralization is done when the bones are put under stress. The stresses help in the mineralization of the bone, the deposition of calcium and phosphorus in the bone. Next is prevent MSK injuries, musculoskeletal injuries. How are these musculoskeletal injuries prevented? By increasing the tensile strength of tendons and ligaments and the muscles which surround the joints. All this helps in preventing the musculoskeletal injury. Okay, improves the healing process. How does it improve the healing process? By increasing the blood supply to that area. When we contract the muscle, we pump the blood, we increase the blood supply to that region, and the contraction of the muscle helps in the venous return, which helps in the removal of the toxins from that area. So this helps in the healing process. The next is improves balance and stability. Growth in the strength, power and the surrounding structures of the joint helps in improving the balance and stability of the body. Okay, and the final indication or use is that strengthening improves the body composition. What is body composition? Body composition is the amount of muscle and the amount of fat in the body. So improving the body composition means increasing the lean body mass, that is the muscle mass in the body, while decreasing the body fat in the body. This is improving the body composition. So next, coming on to the contraindications of strengthening. There are three contraindications. The first one is pain in free active movement. So if the patient has any sort of pain when there is no load applied, moving the joint in a free movement, free active movement, in those conditions we should avoid giving any sort of resistance exercise. Next is inflammatory conditions. In inflammatory conditions, we have two types, that is the neuromuscular inflammation and the joint inflammation. In any sort in neuromuscular inflammation, we should avoid both static and dynamic exercises, but in joint inflammation, we should avoid only the dynamic exercises, but we can give the static exercises to prevent the atrophy of the muscles. Okay. Next is severe cardiopulmonary disease, that is CVSRS disease. So in conditions like myocardial infarction or cardiac or coronary artery bypass surgery, that is CABG, we should avoid giving resistance exercises for up to 12 weeks or until the physician gives a green flag for the resistance exercises. The last topic for the day is how will you progress from grade 0 of MMT to grade 5 of MMT. Okay, what is grade 0? That there is no visible or palpable contraction seen in the person. So in most conditions we will consider that the muscle is denervated. So we will start with galvanic current stimulation. Okay, next we will the galvanic current stimulation and passive ranges of motion to maintain the joint mobility as well as to prevent the adhesion formation, and we will give tactile stimulations over the muscle. Okay, so after doing this thing for quite a period of time, the person will progress to grade 1 of MMT. After the grade 1 of MMT is we can see visible or palpable contraction. The person is able to contract the muscle. So in that condition we will do isometric contractions and we will continue with the neuromuscular facilitation. So now the nerve is innervated, so we will give Faradic current. Okay, and we can use suspension passively, so we can suspend the limb or the muscle and then give the suspension passively. Next, after this the patient will progress to grade 2 of MMT. Grade 2 is complete range of motion in gravity eliminated plane. So suspension, we will continue and ask him to do the suspension activity actively. Next, we will give active assisted to active movements. So we will assist the patient actively against gravity plane, and we will continue it further till the patient can achieve the motion against gravity actively. That will help the patient to reach grade 3. Okay. Then in grade 3 it is full range of motion against gravity. Okay, so we will continue with the active exercises against the gravity, and also we will start with low resistance exercises. Okay, and we will start with the functional tasks, functional day-to-day activities like sit to stand or supine to prone or side lying. We will start with these exercises. Okay. Next is grade 4. Grade 4 is complete range of motion against gravity with 50% of resistance compared to the normal limb. Okay, in this condition we will start with our strengthening programs. We will start with either DLOM or McQueen's technique. So because these are used in acute conditions. Okay, so we will start with that. We will also start with free weight exercises and concentric and eccentric contractions. Okay, after this we will reach grade 5, from grade 4 to grade 5, and after grade 5 we will start with goal oriented training. If the person wants to achieve for daily activities, or the patient is a sports person and he wants to reach a certain amount of strength or power or endurance, according to that we will make a program for that person and train him accordingly. So this was all about part 3 of strengthening. In this we have discussed about the various regimens of strengthening, that is the DLOM, Oxford, McQueen and the Draper. We have discussed in which conditions you will use which protocol, what are the indications and contraindications of strengthening, and lastly we have discussed what all exercises will you give for progression from grade 0 to grade 5. Okay, this last topic is the most hot topic for practical exams. Each and every examiner will ask you this: how will you progress from grade 0 to 3, 3 to 5? Okay, and if you have any doubts related to it, you can let me know in the comment section or DM me on my Instagram. Don't forget to hit the like button and subscribe to this channel and share it with all your physio friends. This is Ronak Chandak signing off.